So dear students, today we will talk about celiac disease. Celiac disease is autoimmune mediated intolerance of gluten. We know about gluten. Gluten is a component of gluten. You know that gluten consists of gluten has a component that is gluten and glutenin. Gluten contains gluten and glutenin. So in this case, in this compounds, the gluten is the immunogenic component. So gluten in this case is the immunogenic. This is immunogenic component. So immunogenic component of gluten is gluten. So what actually happen in the celiac disease is that resistance or intolerance occur to gluten. So body cannot tolerate gluten, and this specifically the sign and symptom usually occur when when a kid start eating wheat, barley and rye, because we know that gluten is present in wheat, barley and rye. So initially we know that the infants start take milk, but when the infant he or she start taking this wheat, barley or rye, then these substances contain gluten, and then symptom of a celiac disease occur, because these children are already having intolerance to gluten, but they don't know because they are not taking wheat, barley or rye, or they, you can say, they are not taking gluten. So when they started eating wheat, barley, rye, then the gluten go into their body, into their intestine, and the autoimmune mediated intolerance of gluten occur, and then we call it the celiac disease. So what actually happen in a celiac disease, we will discuss everything over here. We have another name for celiac disease, that is gluten sensitive enteropathy. That enteropathy means problem in the intestine, and that is sensitivity to gluten. So gluten sensitive enteropathy. And another thing, that is celiac disease is associated with HLA-DQ2 and HLA-DQ8. So this is very very important with respect to exam, that celiac disease is associated with HLA-DQ2 and HLA-DQ8, and the most prevalence is that it is most commonly occur in northern European descent. So celiac disease most commonly most specifically occur in northern European descent. So now we will talk about the location. What is the most common location of the celiac disease? That is orally small intestine, but in the small intestine, the duodenum and the proximal jejunum. So the distal part of the duodenum and the proximal part of the jejunum. Let's, for example, this is the duodenum and this is the jejunum. So this part is the most common location for celiac disease, because this is the distal duodenum and the proximal jejunum. So distal duodenum and proximal jejunum is the most common location for celiac disease. Now, what is celiac disease associated with other conditions? That is very very important, and very very important with respect to exam. So celiac disease is associated with some other condition, and this is very very important with respect to exam. So we will discuss that celiac disease is associated with dermatitis herpetiformis. You can see the diagram in the Google, picture in the Google of dermatitis herpetiformis. So dermatitis herpetiformis is herpes-like lesion on skin. In this case, we see herpes-like lesion on skin, and this is actually caused by deposition of IgA antibody in dermal papillae. So caused by IgA deposition in dermal papillae. So deposition of IgA occur in the dermal papillae, and that cause lesion which are herpes-like lesion on the skin, and that is called as dermatitis herpetiformis. So this is also hypersensitivity. So this resolved with the gluten-free diet. So we know that basic cause is in this case is also gluten. So when we stop eating gluten-free diet, then dermatitis herpetiformis symptoms also disappear. Some other condition with which celiac disease is associated are decreased bone density. The bone density will decrease in celiac disease. There will be moderately high risk of malignancy. So in celiac disease, there will be moderately high risk of malignancy as compared to normal, and the most common is T cell lymphoma. If we talk about the malignancy that can occur inside the celiac disease, then this malignancy will be T cell lymphoma. Now we know that there is intolerance to gluten. The children, the patients cannot tolerate wheat, barley and rye. So there must be something abnormal in their intestinal system. So what actually happens? So the digestion will not normal. So abnormal digestion, this will result in their flatulence, bloating, steatorrhea will occur. Steatorrhea is a fetus stool, and these children will not grow properly. So failure to thrive will occur. So there will be failure to thrive, and iron deficiency anemia will also occur, because here the deficiency occur because the absorption of iron is disturbed. We know that iron absorption occur at the duodenum most specifically. So if the duodenum is involved, distal duodenum, proximal jejunum, so this is the area where some of the iron is absorbing. So if problem occur in this area, then the iron absorption will be disturbed. So iron deficiency anemia will occur. Now we will see three types of antibodies. We will see, and that I will explain a little bit later here. We will see three types of antibody in serology. If we talk about the serology, then we will see three types of antibodies. These antibodies include IgA anti-tissue transglutaminase, second antibody, anti-endomysial antibody, and anti-demyelinated gluten peptide antibody. So you must remember these three antibodies for your exam. These are very important again for exam purpose. Then we have three, similar to three antibodies, we also have three types of serology histological changes. So if we talk about what changes occur in the celiac disease, so we will see in histology we will see three type of changes. First is villous atrophy. Villous atrophy, if you see over here, here is, let's say this is normal villi, but if we see over here, these villi are atrophied in the surface. These villi are atrophied over here because they are not in normal size. So these are the villous atrophy. Then we have another change of histology, that is crypt hyperplasia will also occur. So hyperplasia of the crypt, and then we have intraepithelial lymphocytosis. These are the epithelial cell, and between these epithelial cell, this is a gastric mucosa, and the black lines represent lymphocytes. These are the intraepithelial lymphocytes. So these are the intraepithelial lymphocytes. So we see in histology three main changes: villous atrophy, crypt hyperplasia, and intraepithelial lymphocytosis. So what actually occur over here? Let's say this is gastric lumen. Yeah, if we say intestinal lumen, yeah, this is intestinal lumen, and this is epithelium. You see intestinal epithelium mucosa. These are the epithelial cell, and here the black cells are, these black cells are intraepithelial lymphocytes. So what actually happen over here? If we see, we have gluten that mainly contain gliadin as immunogenic component. When this gliadin enter into the system, then here we have tissue transglutaminase antibodies. These tissue transglutaminase antibodies do deamination of gliadin. So gliadin is deaminated. Gliadin is deamidated. So gliadin is deamidated over here. This blue represent the gliadin. So tissue transglutaminase, what actually it do, this cause deamidation of gliadin. Here we have antigen presenting cell. These are the antigen presenting cell. These are antigen presenting cell that consume the gliadin and present to the T cell. These T cell then activate the B cells, and B cell then produce antibodies that we discussed here. Three types of antibodies. So in this way, gliadin activate these antibodies and autoimmune reaction occurs. So this is a mechanism of how gliadin cause autoimmune reaction in celiac disease. So I hope you have understand. And here I also represented that HLE DQ8 and DQ2 are also studied over here. Then let's come to diagnosis. In diagnosis, if we generally say, we say D-xylo test is usually abnormal, and this occur when the intestinal problem occur, mucosal damage occur. So we know that in celiac disease we have mucosal damage. So if in case of a mucosal damage, we see that the D-xylose, which is a simple sugar that is not absorbed normally, and the level of sugar enter urine of D-xylose test is a decrease as compared to what we take. Usually we take 25 gram of D-xylose and then check blood and urine test of D-xylose level. So if the level are decreased, this means that there is intestinal problem, because the absorption of D-xylose is disturbed. Then we can also do intestinal biopsy or a small bowel biopsy, and in this case biopsy we see for villous atrophy, crypt hyperplasia. So we see for crypt hyperplasia, villous atrophy, and crypt hyperplasia, that we discuss histological changes, and intraepithelial lymphocytosis. These we will see in case of intestinal biopsy. And now let's come to the treatment. So we know that this is in celiac disease is mainly caused by gliadin. So if we use some food that does not contain gliadin or gluten, so this is the basic treatment. So gluten-free diet is the treatment for celiac disease. So this is all about celiac disease. Hope you will understand this. So in order to get more such videos, please subscribe to my channel, like and share and comment what you have problem. So I will help you as much as I can do. So this is all about celiac disease.